If you've been paying attention to the news lately or any of those TMZ style celebrity magazines, you probably know that Justin Bieber has announced on his TikTok and also his Instagram that he has come down with Ramsay-Hunt syndrome. Now, what is that? Well, Ramsay-Hunt syndrome, first of all, it's named after a guy. That's Mr. Ramsay Hunt. He was a neurologist who first described this condition. So what it is it's a disease that can happen as a result of reactivation of the chickenpox virus. With chickenpox, you initially get exposed to the virus and it lives dormant in your body, sometimes for years and years and years. But then when something happens, it could be an emotional stress, or if you become immunocompromised for any reason, certain medications can do this, chemotherapy can do it. For whatever reason, your immune system, which normally fights off the virus and keeps it at bay, it takes a hit. And as a result of this, the virus is then enabled to inflict damage upon cranial nerve 7, or the facial nerve. More specifically, the geniculate ganglion of cranial nerve 7. That's a specific place on the nerve. The problem with this is that the facial nerve, or cranial nerve 7, is the nerve responsible for movement of the face. So one of the most striking symptoms of this condition is unilateral facial paralysis. So that's where just one part of the face becomes paralyzed. And you can see that very clearly in the video that Justin Bieber posted on his TikTok account. Let's take a look at this now.
Hey everyone, Justin here. I have this syndrome called Ramsay-Hunt syndrome.
Yeah, so as you can clearly see, he's able to move the left side of his face. He can smile, he can blink, but is not able to do so on the right. That's because that's where the facial nerve is affected, and he has not only weakness, but paralysis on that side of his face. Other symptoms of this condition include pain and also a vesicular rash. So vesicular refers to a rash that has little fluid-filled blisters, very similar to what you get with chickenpox, except with Ramsay-Hunt syndrome, the rash would be located in the external ear. Other symptoms with this condition include a loss of taste, particularly in the anterior portions of the tongue. Also, some people can even end up with hearing loss and vertigo as well. Vertigo is a sensation of the room spinning. In order to diagnose this condition, a doctor would have to do a very careful physical examination, looking at the ear, looking for any blisters in the ear. Also, a complete neurologic examination would be needed as well, not only at the face, but looking for weakness elsewhere in the body, just to make sure there's nothing else going on. One thing that can be challenging is that in some cases of Ramsay-Hunt syndrome, there's no rash, there's no blisters. All you have is the facial droop. And so this can be quite concerning because lots of things can cause a facial droop or facial paralysis like this. A very dangerous thing would be a stroke. Now, one trick that doctors use to help differentiate a stroke, which is a problem with the brain, versus the Ramsay-Hunt syndrome or Bell's palsy, which is a problem with the peripheral nerve, the facial nerve. A way you can differentiate that is to look at the extent of the face involved. If it's the peripheral nerve, as is the case with Ramsay-Hunt syndrome, the entire face is going to be paralyzed. You won't be able to move the forehead or the lower parts of the face. Now, if it's a stroke, if it's actual damage to the central nervous system or the brain itself, then that is classically forehead sparing. You have people who have a facial droop, like the mouth would droop on one side, but they're still able to move the forehead. But even with that exam maneuver, it still can be tricky to form the diagnosis. And so in medicine, we always do what's called a differential diagnosis. So we make a list of different potential causes for a patient's symptoms. And we have this mnemonic called SPIT. You want to spit on the diagnosis. That's kind of gross when you think about it, but what it stands for is S stands for serious. First, you want to think about the most serious, potentially life-threatening causes of a condition. So if I saw somebody coming in with part of the face paralyzed, a serious cause would be a stroke or a brain bleed. And then P stands for probable. These are things that might be a little more likely to cause the symptoms. Bell's palsy would be a consideration. That's a peripheral neuropathy that can cause the facial droop. And then I is interesting. So these are more rare conditions. And I got to admit, Ramsay-Hunt syndrome falls under this category, I'd say, because it's quite rare. It occurs in less than 1% of patients infected with the virus. And finally, T stands for treatment. So in addition to thinking about the different types of potential causes for a patient's symptoms, we also try to think ahead, think about what other tests might we need to order, or how would we start treating these different conditions. Now, going back to the facial droop and how do we confirm the diagnosis of Ramsay-Hunt? So there's a few other tests that we can order. One of them would be complete blood count. You'd want to look for the white blood cell count, see if it's elevated, any evidence of infection or inflammation. You can also, if there's blisters, try to send the blisters to the lab to undergo what we call the polymerase chain reaction. That's a way that you can identify the actual virus itself. That can be helpful to help confirm the diagnosis. Now, especially in the emergency department setting, there may be other tests that are ordered. A CT head might be one of them. In the ER, we can see anything from very mild illnesses like the common cold all the way up to life-threatening stuff. And for this reason, doctors in the ER setting are more likely to cast a wide net. So run a few initial tests, make sure we're not missing anything really dangerous. Now, once we've made the diagnosis of Ramsay-Hunt syndrome, what do we do next? Well, thankfully, okay, I've had that coming. People have clowned on me for wearing the stethoscope, and actually that is kind of true. I don't really need it right now. But once we've confirmed the diagnosis of Ramsay-Hunt syndrome, or we have a high enough clinical suspicion for Ramsay-Hunt syndrome, we would want to begin treatment. So treatment involves a couple things. Number one would be an anti-inflammatory medication known as a glucocorticoid. An example of this is prednisone. So this is a very strong anti-inflammatory agent, can help to reduce further damage to the nerve. The other mainstay of treatment is antiviral medication. An example of this is acyclovir. Now, ideally, these medications should be started early, preferably within 72 hours of the onset of symptoms. The sooner you start treatment, the more likely it is that you'll have a complete recovery. And that brings me to prognosis. What can you expect with this condition? So for many people, especially if they receive treatment early enough within the first 72 hours, they can regain most functionality. The paralysis, the weakness in the face can resolve. But for some people, they can have long-lasting deficits, including persistent weakness of the face. Around 50% of people with this condition will have some post-herpetic neuralgia, that's neuropathic pain or nerve pain. These persistent symptoms will be more common in people who had a delay in treatment or didn't receive treatment at all. And there you go. That's a quick introduction into Ramsay-Hunt syndrome. We talked about what it is, what causes it, what are the symptoms, how do you diagnose it, and how do you treat it. And with all that said, I do wish Justin Bieber a complete and speedy recovery. I want to see him back on that skateboard and also behind a microphone in the very near future. All right, that's the end of the video. If you enjoyed this or if you found it useful or informative, feel free to hit that subscribe button. Also, you can check out one of my other videos here, and I will see you guys next time.